Hi, my name is Brittany Geis. I'm a student nurse at the University of South Alabama, and today I'm going to be performing my medication administration checkoff. It's my name badge. I'm going to scan the room. My patient, my little workstation. Making sure all the doors are closed. Not going to take any phone calls. This is a no interruption zone. I'm going to limit my conversation to colleagues to absolutely necessary information. So first things first, I'm going to compare my patient care order form to my MAR. Make sure I have the right patient. So this is Jaguar J. Jones. Jaguar J. Jones. Date of birth is 8/25/1963. 8/25/1963. Medical record number is 417-6352. 417-6352. And he has a penicillin allergy. Okay. So then I'm going to compare my medication on the order form to the MAR, so we have the right medication. Heparin. The right dose is 5,000 units. The right route is subcutaneously. And the right time is every 12 hours. Done with that. He has not had it in the last 12 hours, so this is the right time. And the right indication is that he has had a closed head injury, and we don't want him creating any blood clots in his head. All right, so now I'm going to perform hand hygiene. Make sure I grab the correct medication. So I have heparin. I'll compare it to my MAR. So it says heparin and heparin. The order is 5,000 units, and this says 10,000 units per milliliter. And since 5,000 is half of 10,000, we're gonna do half of a milliliter. And the expiration date is 12/5/2025. It's not expired, so it's good to use. Okay, so I'm gonna get my alcohol swab. I'm gonna clean the top. Get my syringe. I have a 1 milliliter tuberculin syringe. Remove the cap. I'm going to draw back 0.5 milliliters of air. Inject it into the vial. Flip it over. Draw back 0.5 or a little bit more so I can make sure to get out if any bubbles. Okay. Pull my safety up so I have 0.5. There we go. 0.5 milliliters. So next I'm going to create a label. Put it on the syringe, making sure not to cover up the dose that's in there, so I can continuously monitor the amount of medication that's in the syringe. On my label, I'm going to write my patient's name, Jaguar J. Jones, and 0.5 milliliters of heparin. Or 5,000 units. I would have a nurse also come up behind me and check my calculation, make sure it's correct. And then I'm going to check. So I have Jaguar J. Jones, and heparin, 5,000 units or 0.5 milliliters. And I have heparin, 0.5 milliliters, and my heparin vial. heparin vial. Heparin label 0.5 milliliters. Jaguar J. Jones. Jaguar J. Jones. Now I'm going to go to the bedside. Good morning, Mr. Jaguar J. Jones. I'm going to give you a shot of heparin this morning, or this afternoon, to prevent any blood clots in your head, in the abdomen, subcutaneously. So I'm going to make sure I have my right patient compared to the MAR. So I have Jaguar J. Jones, age 25/1963, age 25/1963 is the date of birth. Medical record number is 417-6352, 417-6352. My hand hygiene. Don my goggles. Don my, well, I'm going to make sure we're going to do right patient. So I have Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones. And I have heparin vial, heparin 0.5 milliliters in here, heparin 5,000 units or 0.5 milliliters here. Now I'm going to don my gloves. Gloves. This is a subcutaneous injection, so I'm going to do it in the abdomen. So I'm going to go 2 inches away from the umbilicus. I'm not going to go above the costal space. I'm not going to go below the pubic region, and I'm not going to go past the anterior superior iliac spine. So I'm going to clean the site, inner to outer. My syringe. Pull my safety back, pinch, inject slowly. All right, apply gentle pressure. Throw in the sharps container. Sharps container, apply gentle pressure, and I'm going to remove my gloves, perform hand hygiene, ask Mr. Jaguar J. Jones if he's okay, everything's okay. I would also make sure that if he was bleeding anywhere before I gave him the injection. And then I would go back to the nurse's station and then document that I just gave Mr. Jaguar J. Jones 0.5 milliliters or 5,000 units of heparin and the time so he could get it after the next 12 hours. Also, I would come back and check on him as needed.